Hey, welcome everyone. Welcome back to the AOCPMR podcast. My name is Dr. Lachlan. I am currently a media liaison for the AOCPMR Resident Council. And if you're new with us in this podcast, this is the podcast part of the fellowship series where we explore various BMNR subspecialty as well as chatting with current fellow and explore about their unique experience and career path. Um, in this podcast, we're gonna talk about brain injury fellowship. Brain injury is one of the core subspecialty in the physical medicine rehab field. A lot of residents will go through this service as part of their training, and some may call the specialty as their career path calling. So, how to apply into this specialty? What is the timeline and what's the requirement for the fellowship? With us here today is our special guest, who was a physiatrist trained at the Baylor College of Medicine's Physical Medicine Rehab and recently started his fellowship at Spaulding Rehab Hospital, an associate rehab hospital with the Harvard Medical School in Boston, Massachusetts, Dr. Nathan Darji. Thank you so much for being here with us today, and thank you for accepting our invite to be in the podcast.
Yeah, no, thanks for having me, and congratulations to you as well for matching into what I think is an excellent pulmonary residency program at Baylor College of Medicine. So, looking forward to seeing the great things you do in the field.
Yes. I'm very glad I mentioned to the field, and I am very looking forward to the start day of PGY2, especially like at the same program that you went through before as well. So that's going to be very
Mhm.
exciting. And all right, so we're gonna go ahead with the podcast. Before that, I just want to ask some questions regarding about you as a
Mhm.
about yourself. Can you tell us a little bit about yourself? Where are you from? What medical school did you go to? And what residency that you recently graduated from? A little bit about that.
Yeah, yeah, sure. So, as Locke mentioned, my name is Nathan Darji. I'm originally from the Chicagoland area. I grew up there. I went to high school there. And I did my undergrad at the University of Michigan in Ann Arbor, Michigan. Then I came back closer to home for medical school. I did my medical school at Chicago College of Osteopathic Medicine at Midwestern University. Um, and then I decided I wanted to go into PM&R, and I applied and I matched at Baylor College of Medicine in Houston, Texas, where I recently graduated from. I served as the administrative chief resident while I was there. And then I decided I wanted to go into brain injury medicine, and I applied for fellowships. And here I am now at Spaulding Rehabilitation Hospital, affiliated with Harvard Medical School in Boston, Massachusetts. So it's been a great journey so far, and I'm excited to talk to you all more about brain injury medicine today.
Yes, that's an awesome journey you got there. And so I know that BMR is a very diverse field with like a diverse specialty as well. Why did you choose brain injury as your focus in BMR?
Yeah, so I've always kind of been interested in the neurosciences. My undergraduate degree was actually in neuroscience. I've always kind of been this like neuro kind of nerdy person. So when I went into medical school, I naturally thought I was going to do neurology. And then I did a few rotations in neurology, and I just didn't think it was the great fit for me, essentially. I wanted to kind of follow these patients long term and see how they do and kind of help them more on a personal, more meaningful level. And that's when I landed upon physical medicine and rehabilitation. So kind of going into PM&R, I kind of always knew that I wanted to be somewhat involved in the neurorehabilitation realm of the field. So as I did some rotations and brain injury and traumatic brain injury and stroke at Baylor, it really kind of sealed the deal for me. I mean, I was seeing the patient population that I thought I was always interested in, which was his patients who were afflicted by a neurologic injury. And we kind of got to see how they progressed in their inpatient rehabilitation phase. and also how they progressed long term after they were done with inpatient rehab. And what I loved about it so much was that, oftentimes these patients would get better, and kind of being there and helping them throughout that process, I felt really rewarding. And so that's kind of one of the main reasons why I decided to pursue brain injury medicine as a career choice.
Yeah, I understand what you come from in terms of like seeing how patient progress and seeing how they get back the quality of life is like one of the best experience that physical medicine rehab offer, especially like in now you're like very interested in the part of like the brain injury field as well. And
Right.
so what as you know you're like currently a fellow and then gonna be an attending later in the field of brain injury. So
Mm-hmm.
what's role of physiatry usually do in the field of brain injury? I know that neurology also have a role in it, neurosurgeon also have a role in it, and how is the big of a role as a physiatry in that field?
Yeah, so neurosurgeons and neurologists are usually involved in the care of patients with a brain injury in the acute phase. So when they initially present with the brain injury, they're kind of responsible for the more acute management, and neurosurgeons are involved with the neurosurgical management, and the neurologists are responsible for the more medical management in the acute phase. Once the patient's medically stable, they come to inpatient rehab. And that's often when a brain injured patient will encounter the brain injury physiatrist. And really, the responsibility for a brain injury physiatrist is to kind of be the primary care physician for these patients, and kind of rehab PCP is what I like to think of it as. And it's in the brain injury physiatrists, really what they're doing is they're addressing the prevention, diagnosis, treatment, and management of the patient with brain injury, including the related medical, physical, psychosocial, and vocational disabilities that the patient has during their entire lifetime. So oftentimes we're just kind of scratching the surface when they're in inpatient rehab, and they'll continue to have disability and issues related to their disability throughout their lifetime. And so I think that's a nice part about being a physiatrist, is that you often get to follow these patients long term. And as they kind of progress and have, as they get better, they have a new set of challenges. So, for example, oftentimes there's more medical issues when the patient's in inpatient rehab. Once they get discharged, there's more psychosocial, vocational, return to work, return to driving. More sometimes there's more behavioral issues as well when they get home. And so it kind of provides this unique spectrum of challenges as the patient progresses, and it kind of keeps you on your toes. So I think that's definitely something that I enjoy about brain injury medicine. Um, the brain injury physiatrist will take care of patients on the entire spectrum of brain injury, so mild, moderate, and severe. I actually did not get much concussion exposure in residency, and here in fellowship, I'm getting a lot of exposure to mild TBI and concussion. Spaulding is really well known for their concussion program. And so I think that's been a unique experience, because it's very different than the patients that you'd see in moderate and severe brain injury. And then I guess the other thing to note also is that brain injury physiatrists can work in various settings. They can work in inpatient, they can work in outpatient, they can work in consultation type roles in the inpatient hospital and acute care. And then there's also several procedures that are involved, including botulinum toxin injections. You can do trigger point injections, especially if your patient has like cervicogenic neck pain from a whiplash injury or mild traumatic brain injury. And then there's also like intrathecal pump management for spasticity. So there's a lot of fun and exciting things in brain injury medicine. So I think it's a great choice for somebody who is interested in that kind of work.
Oh wow, that's actually a lot. Sound like a lot of fun in the brain injury field. I didn't know about the
Yeah.
whiplash. You can actually use botox for that, and I like the term primary care rehab doctor. That the term the PCP rehab doctor that
Mm-hmm.
you use. Definitely describing like how a physiatrist in the role to the patient. So
Mm-hmm.
so how this is to go straight to the point of like the people that are interested in the field of brain
Mm-hmm.
injury. So how long is brain injury fellowship and what topic like I saw that you covered some of it already, but what topic would the resident continue to like uh, explore more or further cover why they are doing their fellowship in the brain injury field?
Yeah, so all ACGME brain injury medicine fellowships are 1 year long. So it's just 1 year after your residency. And really, the fellow will learn about everything brain injury related, and various diagnoses from mild, moderate to severe, as I mentioned earlier. Um, it's also notable that some programs are purely traumatic brain injury, and most programs I think include traumatic brain injury and stroke into this all-encompassing field called brain injury medicine. And so if you're interested in just traumatic brain injury, then you may want to seek out those fellowships. If you're interested in everything brain injury medicine related, including stroke, then I'd definitely look into those programs. Um, and I guess the other thing that you'll get as a fellow is you'll get some more hands-on exposure to procedures like toxin injections, trigger point injections, intrathecal pump management. Um, I think most residencies do a really good job of getting some basic foundational exposure to brain injury in their residency program. So if you went to a really good program, like myself, I went to Baylor. I don't think I really needed to do a fellowship, and if I really wanted to go out and do brain and practice brain injury medicine and kind of a subspecialized inpatient freestanding rehabilitation hospital. But I think what the fellowship really provides you is kind of more time to do more academic scholarly activities, to give presentations, to get some things published in the literature, and just to kind of gain more confidence and independence in the way you manage and kind of get this higher level expertise. So I think for most people, that's what the fellowship really provides. It's kind of this extra level of training and education. So they can go on and practice independently and be more confident, and also get kind of more scholarly activities under their belt. So I think that's something that at least I was looking for in a fellowship.
Yeah, that's very informative, especially like how you break it down. Like there's some program just focus just only on traumatic brain injury alone by itself, and some that cover like everything. So that's like very something that I learned here from this podcast today. Actually, like there's something very new that I learned. Uh, so uh, so can you tell us the process of like applying to the brain injury fellowship, and what is the
Mhm.
requirements, and how is the like a general timeline if someone like interested in that field?
Yeah, so I most of the people who are applying to brain injury medicine will apply during their fourth year of medical school, or sorry, residency, not medical school. And you need 3 letters of recommendation. So I think one of them needs to be from your program director. For most programs, I would definitely check each program's website and requirements before taking this my advice for all encompassing. Um, you need a personal statement. The application is through ERAS. So for those of you who applied to residency, you're probably very familiar with ERAS. Um, so in my year, it was a little different because of COVID. They kind of provided an extra month or so to submit the application. So I submitted my application in August. Um, and then August 17th, I think, was our deadline. And then I started getting interview invites kind of mid to late September. And my interviews pretty much went until the end of October. There are some programs that interview until mid-November. I think now that they're kind of back on a normal timeline, that may be a little bit different, but I think in general, September to like mid-November is the interview time. And then December, there's like a second or third week of December is match day. Um, so that's kind of the general timeline. And then as far as a process, I think it's definitely good to get mentorship early on, and get involved in research and things like that.
All right, that's very informative about like the whole process of applying. And I know that you mentioned as well that you applied during the difficult time like of COVID-19, and everything was like basically go on virtual. And I know this year they also continue with that as well with the virtual interview. What are some advice that you can give on how like to tackle like this virtual fellowship interview experience? And like since you have been going through it already once already, can you tell a little about that?
Yeah, so like every interview, I think it's important to be prepared. And so practice, get some good, general interview questions, write them down, write down your answers to what them would be. I find like kind of outlining things to be helpful. I usually try to create like a list of at least 5 or 6 like anecdotes that you had throughout your residency experience, meaning like patient encounters or an interaction with an attending, like or a positive interaction or experience that you had that you can kind of tell in a story format, and then you can kind of plug those into various questions depending on what the question is. And I think it kind of provides a more concrete example, and it kind of shows a little bit of your personality in interviews. Um, I found it very helpful to practice with a friend. Luckily, I had a friend who was willing to kind of sit down over Zoom and kind of ask me questions. And I found that very helpful because it really forced me to kind of think in this Zoom format. And I think that that practice session really kind of helped me prepare for the actual virtual interviews. I will note that I think for a 1-year fellowship, whether you're applying to pain medicine, sports medicine, brain injury, spinal cord injury, cancer rehab, whatever it may be, is actually not bad because you're pretty much going to be there for 1 year, and I think most people would agree that you don't necessarily need to see the facilities and kind of be there in person to interact with the faculty and things like that. I think you can get a lot of, I guess, kind of this gut check or culture vibes from the actual Zoom interview. So I didn't find it terribly difficult to kind of rank based on the Zoom format for a fellowship. I think for residency, it may be a little more challenging because you're going to be there for a little longer. But I think for fellowship, I very much prefer the Zoom format. I think traveling long distance and paying for flights and hotels for something like a 1-year fellowship, I think would have been a lot of money and a lot of time and expense. So I actually really enjoyed the Zoom format.
Yeah, I think I agree with that. Like with the Zoom format, there's a lot of a lot of pros coming with it, especially in
Mm,
like traveling time and then like money spent and everything. And you're right about the 1 year fellowship.
mm,
I think that um, something that should be considered in the future as another alternative to like interview like in person versus virtual.
mhm.
Yeah. And
Yeah.
talking about like you talk about like your experience and the story that you need to like prepare for the interview. So what are some of your favorite moments as a BMNR resident that basically shaped you to pursue the fellowship in in brain injury that you have at Baylor?
Yeah, so I think Baylor is a great place to train if you're interested in neurorehabilitation. We spend a lot of time at Tier Memorial Hermann, which I feel is one of the best rehab hospitals in the country. Um, and what I really enjoyed was kind of this close mentorship that I developed with a lot of the brain injury faculty at Tier. They kind of really reeled me in. They saw that I was interested in this, and they started inviting me to like fellowship didactics. They started getting me more involved in procedures. They started getting me more involved in didactics. And so I think that they really foster a culture of mentorship. And so that's literally what I enjoyed in residency. And then obviously kind of getting to know the patients and their families and being part of their process. And I think as a resident uh, at Baylor, you do get a lot of exposure and a chance to be involved with the team. You get to communicate with the therapists, the case managers, and social workers, the patients, their families, and you are very much part of the team. It's not just the attending. And so I think that was really unique. And I think that kind of really helped me become more confident and more I found it more enjoyable to be part of that type of process. And so I think those are some of my favorite memories from TIER and some of the things that I really enjoyed.
That's awesome. You make me even more excited now for the second year of residency. And talking about, just to get back talking about the brain injury fellowship. So,
Sure.
why did you choose spotting as a fellowship to go to?
Yeah, so Spaulding has an incredibly rich academic environment. I mean, there's experts in the field of brain injury medicine. There's experts in the field of every subspecialty of PM&R at Spaulding. So really, that was one of the main reasons why I wanted to go there, because they have such rich opportunities to be involved in academics and for mentorship as well. Um, I can say that, I mean, it's only been like 3 months into my fellowship, and I've already given like 3 lectures. I've already started writing papers and getting involved in research and having weekly meetings with uh, the research lab group and also other people and other faculty members within the department. So they really get you involved in academics and kind of involved in resident education, and so I think it's a very rich learning environment, and that's kind of what I was looking for in a fellowship. In addition to that, the facilities are amazing. I mean, we have ocean views from the Spalding resident room in the fellows area. So I think that definitely kind of gives a nice positive uh, general culture and experience at Spalding. Um, and then I think that Spalding is, like TIER, probably one of the top rehab hospitals in the country. So I couldn't pass up the opportunity to train here. And so far, it's been an incredible experience, and I can't wait to continue my fellowship.
That's like a great program there that you attend right now. And so as a fellow, I know that you to mention about the lectures and teaching and everything. So how much
Hmm.
autonomy does the program give you a fellow as in terms of like managing patients as well as like teaching maybe to the residents and in general giving out lecture and stuff like that? And how much time that they usually also invest into like teaching you like fellows into the fellow for their learning and the educations?
Yeah, so Spalding, they really invest a lot of time in the fellows learning, but they provide a structured environment for self-directed learning as well. So we have these weekly brain injury medicine lecture series, and the fellow presents about 5 times throughout the year. And then there's also journal clubs that we are expected to present 2 to 3 times throughout the year. We have these individual sessions with one of our neuropsychologists where we kind of go over papers and we dissect the papers, and it's kind of like a critical review of the literature um, series. We also we are also involved in research meetings, as I mentioned earlier. And so there's a lot of structured learning time, and then there's also time that's devoted to kind of self-directed learning. So we also have this kind of self-paced course called Factor, which is kind of this clinical and translational research course. It's all through online. We watch videos and do quizzes and things like that. So that's kind of an example of the more self-directed learning that we do. And we are also, as you mentioned, responsible for giving lectures occasionally to the residents. Um, and so we're involved in resident education, and we're also expected to give kind of do bedside teaching and kind of teaching on the side with the residents when they're on service with you, while the attending is kind of taking care of day-to-day duties. So there's a lot of opportunities and to kind of learn and teach and to get more confident in being a kind of holistic, comprehensive brain injury physiatrist.
Wow, that's great. That sounds like they give you a lot of things to do, but then it looked like a very fun thing to do in the fellowship as well in terms of like teaching
Hmm.
and education. Yeah.
Right.
So as a fellow, can you tell us like a day in life, like I think your schedule wise as a fellow, usually?
Yeah, so if I'm on the inpatient service, which I think is like 5 out of the 12 months you're on inpatient, so majority of the time it's spent on an inpatient rotation. We get up in the morning, I get to work. I take a shuttle actually from where I live to Spaulding, which is really convenient. It drops me off right in front of Spaulding, and there's also other people that work at Spaulding on the shuttle, so you get to interact and talk with them on the shuttle, which is always fun. Um, and then I get there, I kind of chart review a little bit, but we don't spend too much time chart reviewing. We kind of round together with the attending and the resident on service. And oftentimes the attending will allow the fellow to kind of make decisions and provide input. And kind of we spend a few hours rounding, and then if it's depending on the day, there's usually team rounds, so we're involved in team rounds, and the fellow and the resident together run the team rounds. So that's always a good experience. Sometimes we also have neurobehavioral rounds as well, which is kind of this Dr. Giacino gets a patient that's on inpatient and does a full kind of neurobehavioral assessment or exam, which I think is a really cool experience. And then oftentimes in the admissions, we're getting, in the afternoon, we're getting ready for admissions that are coming in, and that workload is kind of split between the resident and the fellow, with the attending oftentimes helping out as well. So it's really a team group effort. And then kind of going back to the autonomy piece a little bit, as you kind of progress throughout the year in fellowship, you're given more autonomy. And so the structure kind of changes a little bit. The fellow may round separately than the attending, and then may just kind of check in with the attending later in the day. And so that's kind of how it goes. On Tuesdays, right now, I am in concussion clinic, which is a kind of a nice break away from the inpatient side and kind of provides a little bit of a change of pace. It is obviously a very different population. I see a lot of athletes that are after sport concussion, and I also see some younger adults and adolescents who have sustained a concussion. And we're generally providing kind of counseling and kind of troubleshooting as the patient is recovering from their concussion. And so oftentimes it's a lot of education that we're providing to the patients. And in that clinic, we're provided a pretty significant deal of autonomy. Obviously, we start off because I didn't know much about concussion. We start off just kind of learning a little bit, but as I've kind of gone throughout the months now, I've got more autonomy and being able to kind of manage these patients on my own with just kind of attending oversight. So definitely there's a level of graded autonomy as you kind of progress in your fellowship. And I think that's true for most fellowship programs across the country.
Yeah, that sounds like a great experience there that you have with the program. And just a little bit about the life in general in Boston. How's it like? I know you only been there for like a few months, but how's it like as a living in Boston right now and working with the Spaulding Rehab?
Yeah, so Boston's a great city. It's a great place to live. It's very walkable. I've only been here in the summer so far, so I can say the weather's been beautiful. I've not experienced winter yet, but we'll see how that goes. I've coming from Houston for the past 3 years. I'm definitely a little anxious about the winter here, so we'll see how that goes. But I am from Chicago, so I think I'll be able to handle it. Shouldn't be too much of a problem. There's a lot of cool neighborhoods in Boston. Kind of every little corner is a different neighborhood that provides kind of this unique culture, which I think is really nice. The food is pretty good here. There's a lot of great Italian food, a lot of great seafood if that's what you're interested in. And I think the nice thing about Boston is that it's very close driving to Maine and other areas of New England. So I got a chance to venture out to Portland, Maine a few weekends ago, which is a really beautiful area. It's only an hour and a half drive from Boston, so very close. And then in the fall, New Hampshire and Vermont are really popular areas to go for kind of fall foliage and leaf peeping. So I'm looking forward to doing that in a few weeks. So yeah, I think Boston is a very, very cool and fun area to live in.
It sounds like it. Like you got to travel everywhere around New England. That's pretty nice.
Yeah.
But the winter one is kind of like something that might be a concern for like since you've been in Houston for a longer time. Yeah. But
Yeah.
what okay, so just to get a little bit back about some advice from you as a fellow,
Hmm.
what are your top three questions that you would highly recommend the residents to ask during their like interview for traumatic brain injury fellowship program,
Hmm.
like even before or during the interview, like just like consider like the city and stuff like that. Does that like the one the top three question you would ask or anything that you would like to give
Hmm.
advice on that?
Yeah, so I think it's important. I think in fellowship, you really want good mentorship. You want somebody to kind of be there. It's also a time where you're going to be looking for jobs. So I think you want somebody there who's going to kind of help you through that process. So I think mentorship, asking about what type of opportunities there are for mentorship, who their mentor would be a really good question to ask. Another opportunity would be to kind of ask about how the education is structured. So like I was mentioning earlier, there's a lot of, at Spaulding, there's a combination of kind of structured and self-directed learning. Which I think is a great fit for me, and that's how I learn best. So I think you want to kind of find a place that's going to structure their education curriculum around what works for you. So I think that's definitely a good thing to ask. And then I think the autonomy piece is also a good question. I think fellowship is a time where you want to gain more autonomy. So I would ask how they approach that, and what kind of structure they have in place for fellows to kind of become more independent and confident in their skills before going on to becoming an attending. And then, like you mentioned, I think, the environment that you're going to be in, the type of place it is, what's the city like? Do you need a car? Do you not need a car? Where do most people live? What's the cost of living? What's the food scene like? Those are some things that, depending on who you are and how you plan on spending your time during your fellowship, would be important to ask as well. Um, I do want to spend a little bit of time kind of talking about just general advice for people who are applying to brain injury medicine, and you maybe planning on asking this, but I think it's important if you are going to be applying to brain injury medicine to kind of get involved early during your fellowship, during your residency. You may not know exactly that you want to do brain injury early on, and that's fine. Obviously, work hard during all of your rotations. Find mentors early on who are going to get you involved in scholarly activities and who are going to provide you advice throughout the application process as you move forward. You want to try to get as many toxin injections and procedures under your belt so you have that experience prior to going into fellowship. Go to conferences. I found it helpful. I presented at a few conferences like AAP, and North American Brain Injury Society. And I thought that those were very valuable experiences. I met people there and did a little networking that I thought was very helpful for the fellowship interview process. Um, and do some research. It could be something as simple as a case report, or you can do something more elaborate, like doing an actual study and publishing your research, or you can even do things like book chapters, which I've done a few as well, and I think that's been a really good experience, especially if you're going to be going into fellowship. So just kind of general advice if you are considering applying to brain injury medicine, to kind of do during your residency to make you a good applicant.
Oh, that's a great advice right there. I didn't know that resident can also write a book chapter as well, so I'd
Oh
be
yeah.
interested in that.
Hmm.
Yeah, for
Yep.
sure. And you seem like very well resourceful person with a lot of insight in this field of this brain injury of the subspecialty in PM&R,
Hmm.
and then in medicine in general as well. How can our listener connect with you, like online, or to learn more about you and your current fellowship program right now? Is there a way that we can connect with you by like email or anything by any means that you think of?
Yeah, so certainly if you're interested in brain injury or interested in learning more about PM&R or neurorehabilitation, I'm happy to answer any questions. My email address is ndarji102@gmail.com. Again, that's ndarji102@gmail.com. You can also reach out to me on Twitter at and Darji 102. Again, that's NDARJI 102. I don't tweet too much on Twitter, but I do respond sometimes to direct messages. And if you're interested in learning more about the Spaulding's Brain Injury Medicine Fellowship Program, I suggest you just Google it. And there's a website with all sorts of information that's helpful. And I think they gave like a sample schedule as well, if that's something you're interested in knowing. And so I think that would probably be the best way somebody can learn about the fellowship program.
Yeah, that's great. And if you guys visit our YouTube video, I will make sure that those email and Twitter will be on the video as well for better visualization as well. And thank you so much, Dr. Darji. Is there anything else that you would like the audience to know? Anything that I haven't covered yet in this podcast?
No, not really. I think we covered a lot of ground. Best of luck to anybody who's applying to brain injury or any fellowships after residency. I'm happy to be a resource, as Locke mentioned, for you all.
Yes. All right. Thank you so much. And thank you everyone for listening to the podcast. And we'll be back with another podcast series soon. And stay tuned.